Hi, Miss Woolsey. My name is Joe. I'm your nurse for today. I'm here to do a head-to-toe assessment on you. Is that okay with you?
Mm-hmm.
Okay. Well, first things first, I'm going to check your, if you can tell me your name and date of birth, please.
Sarah Woolsey, 12/12/83.
Okay. And what brings you to us today?
I was having some chest pain.
Okay. Do you know where you are at right now? Can you tell me where you're at right now?
At the hospital.
Okay. And do you know what time of day it is right now? Can you tell me?
This afternoon.
And do you know who our current president is?
Donald Trump.
Donald Trump. Okay. Do you have any allergies
No.
to anything? Okay. Now that I've checked the patient's ABCs, obviously her airway is patent. She's talking to me. She's not having any respiratory issues. She's not having any breathing problems. And when I checked her armband, I checked her skin temperature and her color. She doesn't have any obvious circulatory problems, and she is alert and oriented. She knows where she's at and the time and place. At this time, I'm going to do a set of vitals, check for blood pressure, pulse, respiration, and oxygen saturation. And are you having any pain right now?
No.
No? Okay. And first thing we're going to do is, or second thing we're going to do is actually check for tubing. Let's say she has a IV line on her right wrist. Make sure the IV doesn't have any kinks. Follow it all the way to the IV pump. Make sure that the pump setting is correct. See if she has any other tubings like drains or a Foley catheter. And after that, we're going to start with the head-to-toe assessment. I'll look at the patient's head, make sure it's symmetrical. If you can look at me and look to your right, look to your left, or to your right and to your left, and stick your tongue for me, please. Open up. That's a dog. All right, open up for me, and put your tongue to the right side, left side. Smile for me. Okay. So everything right now is symmetrical. Her oral mucosa and her sinuses and her tongue, they're all pink and moist. And we're gonna check. Where's my stethoscope? And we're gonna now check her chest. I'm just gonna listen to your heart real quick, if you don't mind. I'm gonna expose the area. We're gonna check the apical pulse. It's actually located midclavicular on the fifth intercostal muscle. Now it's different with males and females. It's a little bit harder for the females because of the breast, of course. So I'm gonna check. Look for the lub dub. Make sure that there's a good rhythm, no irregular rhythms, and check for the heart rate. Make sure it's normal and within 60 seconds. And then now we're going to check for the patient's respirations, not respirations, but check for lung sounds. Okay. Now we're going to move to the abdomen. I'm going to expose the patient's abdomen. I'm going to ask the patient, have you had any bowel movements today?
Yes.
Yeah. What kind was it? Was it formed? Was it
A good one.
good one? Did you have any? Did you pee today? Did you void today?
Yes.
And is there anything abnormal? The color is abnormal. Do you have any burning?
Nope.
And Next thing after you expose, we're gonna inspect the abdomen first, make sure there's no protuberances. Um, a normal abdomen would be rounded, some of them would be flat. And then next thing we're gonna ask is, are you having any abdominal pains right now?
No.
Nope. Next thing we're gonna do is auscultate all 4 quadrants. Start from the right upper. And just 8, so it's active. Yeah. Okay. We have positive bowel sounds, and then now we're gonna palpate the abdomen. All right. We're gonna move to the upper extremities. We're gonna check both sides, both arms. Make sure there's no. Make sure that you're gonna have to expose it. Make sure there's no lesions, bruises, scratches, or anything abnormal, any deformities on both arms. Let's see the other side. You're gonna check radial pulses on both arms. Yeah, squeeze your finger for me, please, as hard as you could. All right. Now pull, push. All right. We're gonna check for cap refills. Make sure it's less than 3 seconds on both sides. You're gonna close your eyes for me. Which hand am I touching?
Left. Right. Right. Left.
Okay. Do you have any tingling on your fingers? Nope.
No.
And after that, we're going to move on to the lower extremities. Again, we're going to expose the patient. I'm going to check for any deformities, any scratches, any bruises. I'm going to check for pedal pulses. Of course, you're going to take off the socks or shoes. Check for pedal pulses on both sides. All right, can you push for me, please? Pull up. And check for cap refills. Less than 3 seconds, supposed to. Sorry, is that pushing too hard? Next thing we're going to do is we're going to have you sit up. If you can sit up for me, please. Now for patients or residents, especially on long-term care, this is the best time to check for, while you're checking for lung sounds, you check for any skin breaks on the back and the coccyx and the heels. Actually, I should have checked it in the heels earlier too, but I'm going to listen to lung sounds. Take a deep breath for me. One more time. Like what I said, you check the back and the coccyx if there's any skin breakdowns. Check the heels, and then after that, you let the resident know. Thank the resident. Thank you for letting me do a head-to-toe assessment on you. Cover up the patient again, and pull up the bed rails. Make sure that the call light is within reach. And then, is there anything else I can do for you before I go?
No.
All right. Thank you for letting me do assessment on you, and you have a great day.